Good morning, good morning. And what a lovely morning it is, lovely spring morning. So wherever you're joining me from, I hope it's the same where you are. Welcome home, prescribers. So this is the first group masterclass, monthly masterclass of 2023. I'm going to waffle for a few minutes, as I usually do, just to allow people to pop in, because I know there's a little bit of a delay with registering that you're here. So if you are joining me live, then you're very, very welcome. Do pop your comments, your questions, your experiences, anything at all in the comments as we go along. And if you're watching the replay, equally welcome, and do the same. Obviously, I won't be getting back to you live, but I will get back to you. So today's subject is ear infections and earaches. And these are really prevalent at this time of year, lots of ear stuff. And I'll come on to tell you why that's the case. Very prevalent in children, but can happen in adults as well. But I think as home prescribers, you're probably going to come across it more in your children, or of people's children, maybe. So I was moved to pick this subject because of the lovely case that I shared, which you can see there's a post about that elsewhere in the group. I shared it last week. A wonderful case of a 9-year-old girl who came to me and had been completely deaf in one ear for years and had grommets to no avail, had to sit at the front of the class, couldn't hear in her swimming lessons, was lip reading a lot. And anyway, cut a long story short, you can read the post, but basically one prescription sorted that all out, which is just beautiful. Now, I have to say that isn't my normal experience. It has been on occasion over the years, but normally it takes a little bit more than one prescription. But there you go, it's magic when it happens. So I know that some of you found that inspiring. So I thought I would stay on the subject of ears. So yeah, I'll start now. So why is it that it's mostly amongst children? Now, the kind of official line, the allopathic line, if you like, is that they are still developing their immune systems, and that their eustachian tube, which is the tube that connects the ear, nose, and throat, is much, much smaller. So it's less able to drain fluid, and it's easier for things from outside to get in and stay there, for bacteria to get stuck, basically. And also they are actually they're more horizontal rather than angled. That's the official line, and that may well be the case in some cases. For me, it goes deeper than that. I do observe, and a lot of my colleagues observe worldwide, that things like earaches are on the increase, and they have a particular association with certain jabs. So that will be something that I would look to or look at if you were bringing your child to me as a chronic patient. So that's an aside. Not going to go into that today, but there can be lots of reasons for earaches, and we will come on to that in part later on. So the most common is something called otitis media, and that's a build-up of fluid and matter that shouldn't be there, that is stuck in the middle ear. So that's the area behind the eardrum, and that causes pressure on the eardrum itself, and it can that's most of the time that's what causes the pain. Very intense pain, very very high level, high energy pain. And it's meant to be like that because it's so close to our brain, that vital organ. And those of you that may have joined me in other classes will know that the reason pains are so intense, particularly in the head area, is because there's a very thin barrier between the outside and that damage and our brains. So the pain is there to alert us to that and to make us do something about it very quickly. So that's maybe something that's useful to bear in mind when you have that intense screaming child in front of you in terrible agony. So the typical symptoms would be redness, and that can be external redness and also internal redness, or one or the other. Swelling, and obviously the pain that I've mentioned, and that can affect the mood. So there can be great irritability, there can be a sleepiness, or there can be sleeplessness because of the pain. Often it's accompanied by fever, because the body's trying to fight something. The immune system's kicked in and it's trying to do its job. It can be it can compromise the hearing. So there can be diminished hearing, but there also can be odd noises. And again, we'll come on to that later. And often, because it's a result of something else, the whole head can be kind of full of snot, basically. So there can be just tons of mucus being made. And this is mostly treated by doctors and hospitals with antibiotics, and often repeated courses of antibiotics over long periods of time. And what mums often find is that there's a short period of relief after the antibiotics, and then it all starts up again because the body is still trying to clear something, and it might be dumbed down for a bit, then it'll have another go. And that will go on, and the periods of relief often get shorter and shorter. And the antibiotics seem to do, have less and less of an effect, a beneficial effect. They do have a negative effect, clearly, because they're weakening the system and they're compromising the gut. So, and if it becomes chronic, often then the next course of action would be grommets. And these are little mechanical devices inserted into the ear, which basically help the ear to drain. And those are for young children because of that alleged drainage issue. And they're then removed, or they fall out, or they're eliminated when they're no longer needed. What is the next part of my thing? Yes. Okay. So what do we do? We've got a child in front of us screaming in pain. Often it happens at night because it just does with children. And what do we do? So the first thing is to not panic, to actually remember, just, put your practitioner hat on, or put your home prescriber hat on, and say, okay, knowing that there's an earache there, knowing that there's an ear infection isn't enough for me to select an appropriate remedy. So you're going to need to take a proper case. So first of all, and going through, again, those of you who have been here a while, you'll know that I bang on about the CLAMS method of taking a case. Very useful and really good to have it as a prompt with your remedy kits or your remedy tool boxes. So good morning, Gillian. Thank you for joining me. So the first of the CLAMS prompt, the C, is for concomitants, which is a mouthful of a word, which means basically what else is going on. So the first thing you do is go, okay, we'll clock the ear. We've got all the pain and the, any external redness, all of that. Now, what else is going on? Is there a head full of snot? The ear, nose and throat are connected. We know this. So there might well be a sore throat as well. There might well be something like swollen tonsils. So always check the throat. Also, obviously checking both ears, because even though one ear might be worse than the other, it could well be going on in both ears, or it might be just one. And as we know, the size of the body can help you. Also check the eyes, because often if the body is trying to eliminate mucus and matter, that the eyes are another possible exit route. So sometimes it may be accompanied by something like that appears to be conjunctivitis or something like that. So what's going on there too? Is there a generalized fever, as I said, as well as the localized inflammation? Because again, that's going to give you resources to select your remedy. Are there coughs going on? Is there a general cold? What came first? Is there sinusitis maybe? Is there a postnasal drip? So basically, often young children can't tell you this, but if there is a sense that something's dripping down the back of the throat, then it's coming from the sinuses often. That's another way that the body will try and get rid of excess mucus. Checking the bowels is always useful, especially in young children, because that's a way that young children get rid of mucus. So if you think that the stools are a bit more sticky and mucousy, lob that into your case taking. Teething is a massive cause for earaches in young kids. Very common, especially children who are prone to making a lot of mucus generally. So that could well be the cause. Or it could be that it's the other way round, and that the earache actually extends into the jaw and into the teeth. So that's something to look out for. And obviously, if there is a head full of snot and there is, mechanical misalignment going on, then there can be headaches as well. And often when there's a lot of mucus being made, then that drains the body of a lot of water. So there can be a need for more water, so the headaches can set in. There can be a sort of slight edging towards dehydration. And obviously looking for mood changes, so crankiness, clinginess, delirium, appetite changes, all of those things. So that's what you're looking for first of all, is concomitance, something else, everything else that's going on as well as the earache. Then the L of clams would be location. So again, you're looking at which ear is it? Is it the right ear or is it the left ear? Because that will narrow down your choice of remedies. We've said the ear, nose and throat are connected, so check all of those. And again, is it only one side? Because it might be. Does the pain, when it's being experienced, does it travel to other parts of the body? Sometimes, a child might say it really hurts here, but it's also hurting in my left elbow or, in my tummy. So check all of that. And just where in the body things are being experienced. Don't take that for granted, because it will help you with your remedy selection. The A of clams is etiology. And there's a post about this, about the clams method, by the way, pinned to the top of the group if you want a reminder of it. So the etiology. So do you think there's an obvious reason, or, any reason that you can think of that might have brought this on? Cold wind can be a big etiology. Aconite, huge kind of inflammation remedy, hates cold wind. Lots of remedies hate cold wind, actually. So has the child been exposed to cold winds recently? And do you know that they're kind of sensitive to them anyway? That's one thing. Winter itself can be a trigger, can be an etiology. If you've got a child who gets earaches every winter, that's something that will help you to confirm your remedy choice often. Carbs would be in that bracket, by the way. Also, another possibility for calcs would be that a change of season. And this is often why at this particular time of year, when we're moving out of winter and into spring, why earaches can pop up. Because often it's the change from one season to another, or from one circumstance to another. So, if there's been some kind of change in the school situation or the home situation, if there's something that your child has been a little bit rattled by, or that he or she is rattled by change generally, then that's a possible etiology. Teething, as I said, massive cause of earaches. So that will really help you to narrow down your remedy choice. As I indicated, and I'm not going to go into it in detail, but vaccinations can be a big cause, or any other kind of medication if your child is that way inclined. If your child needs to get rid of stuff and the way that they do it is by making lots of mucus, then it could well be that that's got a part to play. Now, that's obviously something that's more for your practitioner to sort out, but it's good to notice those things so that you can actually let your practitioner know. Injuries. We don't often think about that, but sometimes, there's an injury, there's some kind of damage to the ear. Actually, I remember when my daughter shoved a wooden bead down her ear, and we couldn't work out for ages what on earth the problem was, but that's what she'd done. She'd stuffed a bead down her ear. There you go, that's kids for you. And shock, obviously, is another one. So those are all possible etiologies. So just have a think. You don't always know, but just have a think about it. So the M of clams is modalities. So what's it better or worse for? Sometimes, weirdly, even though there's a lot of pain, it can actually feel better for lying on it, for putting pressure on it in some way. And other times it will be like, no, do not touch it. So those little differences are, again, going to lead you to a correct remedy choice. Does it feel hot? Does it feel cold? Is it better for cold? Or is it better for heat? Because it can be raging hot, but still get some relief from heat being applied, a warm flannel, or even the warmth of a hand, or the opposite. It can be, better for a cold flannel or a cold hand. Collect those symptoms. And again, times of the day. So, maybe the child is absolutely fine during the day and then in the evening it all kicks off. Or maybe it's the other way around. Maybe they are fine through the night and it's terrible during the day. Maybe it's certain times of the day that things seem to flare up. So looking for all of those modalities. Those are the details that will help you. And then finally, S for sensations. And I'm just racing through this because it's just a reminder, really, for what to look for. So asking, what does it feel like to the patient? And even very young children can tell you very eloquently what it feels like in their own language. So asking for those sounds, if there are any sounds in the ear, is it like water running? Is it the sound is muffled? Does it feel really hot inside the ear, or does it feel really cold? Is it that drafts, any kind of drafts or wind, can really aggravate it, really make it worse? Are they extra sensitive to noises, to loud noises or certain noises? And also, what's the nature of the pain? And this can be a hard one, and you have to kind of lead the witness a little bit on this. So asking, okay, when you think about that pain, is it throbbing? Is it pulsating? Is it sharp? Is it there all the time or just sometimes? Does the pain stay within the ear, or does it go up the head or into the jaw or down the neck? Is it a constant ache? Yeah, I mean, there's lots. Is it a sticking pain like needles, or you just try and get some kind of definition as to what that pain is actually like for the patient. And again, the mood will tell you so a lot. So looking at how they're doing it. So are they really weepy and pathetic and clingy and very postilla? Or are they really cranky and asking for things and throwing them away again? Very Camomilla. Do they want company, or do they want you all to go away? Do they want to be touched, or do they not want to be touched? All of those sensations, the feelings are going to help you with your case taking. So, any questions at this stage? Just give me some kind of thumbs up or something to just make sure that everything's making sense and that is what you would do when you're collecting symptoms. Good morning, Surinder. Thanks for joining. Okay, so coming on to possible remedies, and there are obviously hundreds of remedies that might be indicated. But for you, if you really can't think of, or you can't collect enough symptoms, and you're just not sure, and it's the middle of the night, or you can't, you haven't got any other remedies to hand, your absolute top best option in 9 times out of 10 will be ABC. So if you haven't already got ABC in your remedy kits, get some. So for those of you who might not know what that is, that's a combination remedy of 3 of the top remedies: aconite, belladonna, and chamomilla. You can get it from, if you're in the UK, you can order it from the pharmacies. Helios do it ready made up. I think I might only be in a 30. If you were coming to me, then I would almost invariably do that in a 200 potency, and we'll come on to talk about potency later, but that to me matches the intensity of the dis-ease much more appropriately. But use what you've got, and if you have 30s, just give them more frequently, or give them as you observe they're needed. So ABC, the top one. Breaking that down, belladonna, again, if you haven't got ABC, belladonna would be my top one, my absolute number one for earaches, particularly otitis media, particularly if it's right-sided, and if the pain is throbbing, pulsating, throbbing pain. If there's heat and swelling, and there's a slight kind of slightly delirious, can be red in the face, a bit glassy-eyed, can be quite aggressive in that delirium. My daughter used to get earaches when she was very little, and it was one of the first remedies I used with her, and it was amazing, actually. I remember she was very like that. She was very, quite aggressive, tried to bite me, and screaming in pain, and gave belladonna. And at the time, I wasn't a practitioner. I was like you, I was a learning home prescriber. And we gave the first dose of belladonna, 30 from the kit, and it stopped for a little bit. I think for about 10 minutes, everything kind of quietened down, and then it revved up again. So we repeated it, and I think the relief was just over an hour with the second dose. And we were thinking, oh, this is great. And then it all started again. Each time, not quite as intensely as it had done before, but bad enough. And then we repeated it a third time, and she just went to sleep. She just went to sleep, and she slept for, I think about 3 or 4 hours. And we were like, oh my God, is this okay? But she seemed to be very peaceful and sleeping fine. And then when she woke up, no problem. She didn't need any more. And then every time she experienced an earache going on from that moment, they were the gaps in between her getting them got longer and longer and longer. And when they did come, they were very mild, and most of the time, one dose would sort it out. So, and that's the pattern you're looking for, really. And it's often what can happen when you're treating acutes, which is why home prescribing is such an important part of minding your health or anyone else's health. So, yeah, belladonna. They can be very, very sensitive to loud noises in particular, and to being jolted, being jarred. They don't like being sudden movements. They are worse after cold. They're tend to be worse at night. Strangely, they can actually be worse from having their hair washed or having their hair cut. So that's a possible etiology. So the next one on the ABC list would be chamomilla. Again, a really big earache remedy. You will get the swelling and the heat, but you often only get one cheek that's red if there's a fever there, rather than both cheeks with belladonna. They can be really bad-tempered. They do not do pain well, so they feel it very intensely, and they will often be in such pain that they don't know what they want. So they're very changeable. They're very hard to please. They will ask for things and throw them away. And interestingly, obviously, chamomilla is the biggest or the most commonly prescribed teething remedy. So it'll do for both, as will ABC and belladonna if it's indicated, which is why we take all the symptoms and we prescribe a remedy that best suits all of it, not just a tiny bit of it, if you can. What else? Oh, yes. They can have the noises in their ear can be a roaring noise, or it can be like rushing water, or they can have a sensation as if there's hot water running out of their ear. They are worse for colds. They are also worse at night, and they are worse for teething. And they find any kind of pain unbearable. Breath can be smelly, and invariably there might be a fever there. The A of the ABC, the aconite, again, great for otitis media. You'll see then that the external ear is red hot, swollen. There will be pain. You'll get roaring noises again, and a sensation of a drop. So not the hot water trickling out, but just a drop of water. And it's usually in the left ear. There can be very tickly sensations and sharp pains. Again, very sensitive to noise, and much better for a rest and for open air, but not cold wind. They do not like cold wind at all. And they actually can feel better. The pain can be slightly relieved if they're actually lying on the affected ear. And again, they're a big teething remedy. So you can give the ABC, as one combined remedy. If you wanted to, and you've got those three separately and you're not sure how to differentiate between the three, you could give one of each at the same time. Or you could alternate the three if you really can't choose, and see which one is doing the most work. So, other possible remedies. I mentioned at the beginning that calc carbs do a lot of mucus and can do a lot of ear, nose and throat stuff and chest stuff. They're very, very mucousy often. So calcs, although when they're well, they're quite independent and quite stoic and kind of get on with things. When they're ill, they can get a little bit clingy. They can want to be carried, and they're not like pulsatillas. They're not like really in your face, but they just need a bit of extra TLC. And the pain can be aching. There can be a sensation of the ear being blocked. They can get, again, that roaring water noise. The pains can be stitching, and they can be better for warmth. They feel better if they're being carried for small children. They are also better for lying on the painful side. And the glands around the neck in particular can get very swollen as well. They can have deafness, and that's my lovely case that I shared earlier on in this week. Calc is the remedy that helped to sort out her deafness. And that deafness can actually be worse for them blowing their nose or for coughing, for teething. It's another big teething remedy. If there's an issue with teething, it might well go into the ears and the chest and make lots of mucus generally. And they can also have really bad nightmares, really bad dreams if they've got the earaches going on as well. And the next remedy would be pulsatilla, another very common remedy for otorrhea, it's called. So it's if there's a need to drain the ears, pulsatilla can be really helpful in that regard. They are classically pulsatilla, so weepy, clingy, needy. They're not the kind of mild, I need to be carried in a little bit of TLC like calcs. They're like really in your face and don't leave the room or I'm going to burst into tears. I'm going to cling on to you and I just want you to carry me everywhere. The lobes of the ears can get quite swollen. And there can also be discharges coming from the ear because of that, that need to drain. Thick, bland, yellowy green discharges, and that can be happening from the nose as well, or post-nasally. The sinuses can be blocked. The hearing can be blocked. There can be a general sensation of something being forced out of the ear. And again, the breath can be smelly. It's that kind of stale, cold smell. And the symptoms can be really changeable. So if you just cannot keep pace with all the different symptoms that this child is doing, and you think, oh my God, 1 minute it's this, next minute it's that, it's just can't keep pace with it, that would be a pulsatilla symptom. They are, if they're weeping, clinging as well, then that's enough for me to prescribe. They are also worse in the evening. They're worse being on their own. They want people close by. They want them to be looking after them. And they are much better for fresh air, and they feel worse in a hot, stuffy room. So they're better for cold applications, actually. And they are better for touch generally. So they quite like you to be stroking them and, making them feel better, basically, rubbing. Good morning, Pauline. You're very welcome. And I think, is it Katie up there as well? Yeah. Good morning to you all. Thanks for joining me. And the next remedy I'm going to talk about is silica. Very useful remedy for earaches. There's a lot of sepsis with silica, a lot of abscesses and boils, and there can be perforated eardrums. There can be very useful if you've got, as I said earlier, a child who's stuffed some kind of foreign object down its ear. and that's the cause of the problem. So it's good at helping the body to get those objects out. So if you think there's something down there that shouldn't be there, then silica would be the remedy to use. Great for mastoiditis, which is it's the tiny bone behind the ear, and that can be affected or infected. It's a bone that can start to decay if there's a lot of infection there permanently, chronically, and that can be quite painful. So silica's great for that. Silica's a great bone remedy generally, and tooth remedy. So there can be a sensation of the ear being blocked up, and unlike what was the remedy? Worse for blowing. It was worse. That's right. Calc is worse for blowing the nose. Silica is actually better for blowing the nose. So better for blowing the nose, better for swallowing or yawning. It just relieves the pain, or it relieves the stopped up sensation. And children often are boring their fingers into their ears. You might see that before the pain starts even. There can be hissing sounds if there's any impaired hearing or funny noises in the ears. There can be itching, a lot of itching, which is why the fingers get stuffed into the ears. They can be very cold, silicas, and therefore much better for warmth. They like to have their heads wrapped up, so a nice scarf around the whole head, or a hat jammed down over the ears. And they are much worse for cold generally. And so don't like to be bathed, really don't like their hair being combed. They can be affected by the moon as well. So if you notice those kind of things, then any kind of change in the moon can set things off. Or changes in the weather, which is interesting because silica, there's quite a high proportion of silica within calc carb, and calc has that feature of not being able to do changes very well. And generally they can appear weak, thin, pale, fragile, really, basically. So that's silica. And 3 more remedies. I think it's 3 more remedies. Hepatic sulf. And I'm focusing deliberately on the remedies that will be in your kits. I mean, there are other remedies indicated always, but this is just a little taster for you. So hepatic sulf, again, otitis media, great for that. Very sensitive to wind and drafts, any draft. They will sense the tiniest draft in the room. They will feel it. Very cold, and can have, again, it's a remedy that's very much about suppuration and pus, infection. So they can have whizzing noises in the ear, or throbbing, actually, with diminished hearing. And they might have kind of pustules. Sometimes you can, it can appear to be an inner ear infection, or it can be an inner ear infection that started with some kind of spot that's gone septic, a boil, or or even eczema or scraped skin that's gone infected. So if you've got a child that is very prone to breaks in the skin getting infected, and you've got those symptoms, then hepatic sulf might very well be your remedy. So again, they like their heads wrapped up. They're very cold, so they like the heads wrapped up. They can be really cranky and irritable, but also quite sad. They can have a lot of catarrh, and they can have kind of splinter-like pains and a lot of sweating. Another remedy, Kali Bic. So that's Kali is with a K, and the Bic is BICH. Pretty sure that's in your kit. Tell me if it isn't. Pretty sure it is though. And they have earaches that are often accompanied by sinusitis. There's actually a lovely another combination remedy for sinus drainage generally, actually, which is PKH, or sometimes it's called KPH, but it's Kali-Bic, pulsatilla, and another remedy called hydrastis, which won't be in your kit. But even if you just actually if you felt that drainage was what was needed, and the individual symptoms match, then using Kali-Bic and pulsatilla, alternating them or both together, can set up a nice drainage. So you'll see a lot more stuff coming out, but that's what you want. And gradually you'll see that changes down from being green, if it's green, down to yellow, down to opaque, down to clear, and then, it'll just stop. It'll be watery, or it'll just stop. And that's exactly what you want. That's supporting a process rather than stopping symptoms from happening, or expressions from resolving. If that makes sense. I hope that makes sense. Let me know if it doesn't, or if it does. Okay, so Kali-Bic. The snot, the mucus, is usually a kind of yellowy green, and it's thick and it's stringy. It comes out in strings. It's ropey. They can have very sharp pains in the ear. There can be really violent tickling in the ears as well. If there's a lot of mucus and it's originally in the inner ear or the middle ear, then it may well be accompanied by a perforated eardrum. It's better for moving around, so motion. Better for pressure, again, so may be better to hold the ear or to lie on it. Better for open air, not better for cold, so worse for cold. So actually, weirdly, might feel worse for undressing, getting undressed, and that's because of that exposure to cold air, and worse for damp. It can be worse in the morning, and can also be worse for bending down, for stooping, and that's the pressure again, often in the sinuses and in this whole ear, nose, throat area. Just puts additional pressure on it when you stoop, basically, so that's why. And they can be worse after sleep. And just as an aside, actually, perforated eardrums, everyone's really worried about perforated eardrums, and it's, almost regarded as a kind of medical emergency. It's not great, but eardrums repair very easily, especially in children, actually. And often the eardrum needs to perforate in order for that drainage to happen. If that's the best way for the body to actually get that matter out of the head, remember, near the brain, then it will do that. It will burst the eardrum, the fluid will come out if you let it, and then the job will be done, and the eardrum will repair itself with the aid of remedies and time and staying calm. So that's a little aside. Mercury is the next remedy. Merc Viv, or what's the other mercury that you call? Merc Cor. I think it's Merc Viv that's in your kits. That's the one that you'll probably get hold of mostly. Those symptoms can be very changeable as well, but they're not weepy and clingy like pulsatillas. So that's the way to tell them apart. They're a bit like, if you think about mercury in a thermometer, an old-fashioned thermometer, it's there because of its sensitivity to temperature changes. So if you're in a mercury state, you can be highly sensitive to anything, any temperature changes. So it could be becoming heated, or it could be getting very cold. There can be pains that travel to the jaw, and the teeth and the throat. There can be thick yellow kind of blood-specked discharges. There can be a lot of sweating, but there's no relief from that sweating. That can happen particularly at night. Deafness, and the deafness can come on if they're overheated. So that can be much worse. They are actually better for swallowing or blowing their nose. And they can have a sensation of cold water running in the ear. They can have boils. They're generally worse at night. They can be worse for getting their feet wet or damp. They're generally better for resting. They're resting better for a stable environment, so a stable temperature in particular, and stable conditions. They can be quite restless, quite anxious, and as I said in the beginning, changeable mood-wise as well as symptom-wise. They can also be quite mistrustful and argumentative. They're not the easiest of patients. They're a bit stroppy. So those are the main remedies that you will have access to. So lots of choices there. Generally speaking, if you can pick one remedy, even if you try it for an hour, and if you think at the end of the hour, if you're dosing every 15 minutes, it's not having any effect, change your remedy. If you need to dose it more than every 15 minutes, which you may do in the beginning, especially if the pains are really, really intense, go for it. Nothing bad can happen from that. You want to just see that there is some relief. I mean, the lovely thing about earaches is that because the pain is usually pretty intense, you will have a perfect ability to measure the success of it, the remedy. Because if the pain diminishes, even if it's just dialed down a bit, you know that the remedy is having an effect. Just keep giving it until the child is able to do the work on their own without the aid of a remedy. That's the point of giving remedies, is to kickstart the immune system into doing what it should be doing anyway and isn't for some reason. So potency and repetition are of equal importance to your choice of remedy, always, actually. So often, obviously for you guys in the kits, they're 30 Cs. So, and that's absolutely fine. What it means is that you will need to often give it more frequently than if you had, say, a 200. But there's nothing wrong with it at all. You just need to give it more frequently than if you had a 200. So if you've got 200s, yay, great. You'll probably find those gaps of relief are a bit longer than if you're giving the 30s. What you're trying to do always is match the potency with the intensity of what's being experienced. So for me, something like an earache, similarly to period pain, period cramps, it's a really intense, debilitating pain. So it's quite high frequency because it's going, look at me, look at me, look at me, pay attention, get this sorted now. It's urgent, urgent, urgent. It's not like, it's okay, I can manage it. So you want to be giving a kind of urgent, high frequency potency if you can. And 30 it can be enough to do that. 200 is often better in my experience. So work with what you've got, obviously, because the remedy you've got is way better than the remedy you haven't got. But just to bear that in mind. So don't be afraid to give things quite regularly, as long as you're seeing effects, good effects. Yep. And also you can increase the efficacy of your remedy by water dosing. So you can pop one of your remedies in some water, give it a good shake, and let your child sip on it, regularly. You can do it like that. That will not only spread out the dosing for you, but it often means that you're slightly, especially if you're banging it each time, you're shaking it up each time you give it, you're slightly changing the frequency of the remedy each time you do that. So that's a way of doing it. When really young kids, or kids who might be very difficult to get a remedy into, that also can enable you to give it in a slightly different way, which is maybe rubbing it on the feet or on the belly, somewhere like that. Soles of the feet are best because it's so absorbent in that area. So that's another way of dosing. So additional supports. We're coming to the end of our hour. So any questions on remedies before I go on to the additional supports? Do you have any observations? Have you actually treated earaches with any remedies and had good effects, or not? Do share, because it's always useful for people to hear other people's experiences, I think. Or if you've used a remedy that I haven't mentioned, then that would be handy, because obviously all remedies can be got either from practitioners or from the pharmacies. So let me know. So yeah, coming on to additional supports. Hydrogen peroxide is something that I would always have in my toolkit. You can get it in the pharmacies, very low potencies now. Just little bottles, about €4, something like that. And it's a type of bleach, but it isn't like household bleach. And if you pop it a few drops into the ear, the affected or infected ear, if you get the child to lie on the non-infected ear, and just it tickles and fizzes, and as it does that, it warms up the area, and basically it is dissolving or eating any bacteria or stuff that shouldn't be there. So that can be a nice thing to pop in. I'd be cautious. I wouldn't necessarily do that if you know that there's a perforated eardrum. But I do know people who have, and it's been absolutely fine. But it's an additional kind of clean-up tool, if you like. Also, warm oils. So I don't mean essential oils. I mean just warm olive oil, or there's a lovely herbal oil called verbascum, or oil of mullein. It's the same thing, and that has an affinity with the ear. So you can often, just putting some warm oil in with a little cotton wool plug can really help just relieve discomfort and to help clean up the area. Essential oils like lavender or tea tree, always diluted, and always apply to the external ear first and see how the patient responds to it. But I have a couple of clients who use essential oils first and foremost for virtually everything, and they would swear on using things like lavender oil for ear infections and earaches. Just try around the area first, and then always dilute it. One drop in the ear can really help. I personally would be cautious if there's broken skin, because it can be quite painful to put an essential oil on, which is why you dilute it. But it can help enormously. So can gargling with essential oils, something like lavender or tea tree, if you've got somebody that's old enough to do that. Now, obviously, chamomile tea, if it's teething and you have a child that's responding to chamomilla as a remedy, then sipping chamomile tea can be useful. And chamomile, the essential oil, also can be used. Chronic treatments. Basically, if you've got a child that's doing this a lot, repeatedly, with and you can manage it acutely, but it keeps coming back, then you need to seek chronic treatment. We need to get to the bottom of why that's happening, because clearly that's not something that should be going on and on and on. And given that there's usually mucus involved, then just being sensible about avoiding mucus-making foods. So, cow's milk is not a great thing to be giving when there's a lot of mucus being made, because you just make more mucus. Sugar, generally, and that's how the body regards cow's milk anyway, is as a sugar. So sugars to be avoided, things like that. If you happen to be breastfeeding and this is a very young child, doing earaches, breast milk actually in the ear can be great. And also, it's another way, if you feel so inclined, often mum can take the remedy as well as baby. So that's another way of getting stuff in. I would always also be encouraging a fever, encouraging the body to start doing its own healing work. So making sure that the patient is kept warm, and that you're almost encouraging a sweating or a fever. So no going out in the cold or doing anything like that. And obviously rest and TLC. And yeah, that's about it. So that's what I have on ear infections and earaches. I hope that you found it useful. So, all of this stuff, if you're writing it down, and you can do that even if you've been watching and not taking notes, you can watch the replay and take notes from that. Keep them with your remedies and your remedy charts if you've got them, and any of those books. Just a reminder that there's a pinned post at the top of the group with a book list, suggested book list. And if anybody's interested in my remedy charts, then you can just contact me and I can, send you a PDF of those. Yeah, that's about it. So happy prescribing, be confident. You've got nothing to lose. Just try those remedies, try them frequently. You'd be very surprised how quickly things turn around when you hit upon the right prescription. And don't be afraid to give frequently. Don't be afraid to stop one remedy after, and I wouldn't go any more than an hour. If you really are not seeing improvements, change to the next remedy and just work your way through. And if you can't get any relief from anything that you're selecting, then you know where I am, or you can ask in the group, or obviously do whatever else you feel is needed to get things resolved. Okay, have a beautiful weekend, and yeah, I hope that none of you have to go through earaches with your own children, but if you do, you now have the tools. Okay, thanks for watching. Bye-bye.